window, boom, share. Okay, do we see the person hiking here? Okay, question for you all. Who can tell me what this white band is right here?
IT band?
Yeah, what is IT stand? It is, by the way, both of you are right.
Iliotibial?
Now you're three right answers. No, they're all correct. It is. So the iliotibial band, the IT band, is a band that goes from your hip. It's over the top. It's over the top of the vastus lateralis, because that's on the side of your leg. The IT band is on the side of your leg. It goes from your hip and crosses over your knee, and it gives you structural support laterally. We'll get into it later, but it's very, very important. It is a band of fascia. It's like a long, thin tendon. Like a long, wide, but thin tendon, like a belt running down your leg. You can feel it on people, but it's called the iliotibial band. It's a band of fascia. Cool. Okay.
So, before we go past that,
Please.
sorry.
No, don't be sorry.
If it's a tendon. Okay, so if it's a tendon, then it attaches muscle to bone. Is it just because it's attaching to all of that? Or is it actually attaching a specific muscle and then goes all the way down?
Miss Monreal, you make me so happy. Because you process what I say, and then you ask questions based on your thinking on what I say, instead of just trying to memorize it or whatever. Yes, I call it a tendon because it does attach to a muscle. There is a muscle in your hip called the tensor fascia lata, or tensor fascia latae, that attaches to your IT band. And your IT band actually attaches into your gluteus maximus as well. A lot of people don't know that, but it does. And that's why I call it a tendon, because it really is a long tendon coming off those things going down and across your knee. And so people could argue lots of things, but I call it a tendon for that reason. It definitely attaches muscle to bone.
Okay.
Thank you for that. And we will study those muscles particularly, probably not till after Christmas though, believe it or not. Anyway.
Okay, thank you.
Thank you. Okay, so can we all see the picture of this beautiful thigh? We should be able to see, I hope you can see my cursor too. Oh, did I not start the slideshow?
Is this in our book somewhere? This page?
Well, I hope so. Page 296. By the way, I'm sorry, I didn't mean that sarcastic, but I just meant I really hope it's there.
Yeah, it is. It's 296.
Okay, cool. They've cut away a lot of stuff so you can see here. One is your thigh bone in the way. But can you guys see my cursor?
Yes, sir.
Good. My cursor is on what muscle? It's
That's
labeled.
the teardrop muscle. Isn't that the...
It's labeled.
Medialis, I mean?
What medialis?
Vastus.
Yeah. Vastus medialis. It is the teardrop muscle. You can actually see it in your own thigh. It's that bump on the inner side of your knee sometimes, above your knee. But it's called the vastus medialis. Over here on this outside part, we have the vastus what? Anybody?
Lateralis.
Thank you. Thank you, Miss Harper. And by the way, there's a thin, stringy thing coming down from the tensor fascia lata, this white thing going way, 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 way down here over top of the vastus lateralis. What was that? We just talked about it.
The IT band?
That is the IT band. What does IT band stand for? No. It goes from your ilium, your hip, crest of your ilium, to your tibia. So some people like to call it your iliotibial band.
Okay, iliotibial joint.
Yeah, iliotibial band.
Band, sorry.
Yeah. Cool. All right. What's this muscle right here? Oh, sorry.
Rectus femoris.
Yes. Why can we not see the vastus intermedius?
Because it's deeper.
Thank you. Okay. Here's a side view of the leg. Here's the IT band again. You can actually see it feeding into the glutes here, by the way, and into the hips. This is why they call it the iliotibial, this is your tibia down here, band. But underneath it, making up the entire lateral compartment of your thigh, is the vastus lateralis. The entire side of your thigh is vastus lateralis. Yes, Miss Monreal.
So sometimes people say my IT band is tight, but because it's that fascia, well, of course it would be tight, but is it really the muscles that attach to it that are maybe being compromised and therefore pulling on it? I don't know.
Yeah, I don't either, actually. It could be both, right? It could be the muscles, and definitely as a good massage therapist, you take a look at the glutes and the tensor fasciae latae, or tensor fascia lata, because those could be pulling on it. It'd be wonderful if that was it, because those are easy to solve, because muscles are actually easier to loosen up than fascia. But then you would also massage the IT band to try to loosen it up, probably kind of deeply, but it's very sensitive. But before you did it, you talked to Miss Yanez, and she'd say, you should massage the IT band proximally so that you don't scissor it between your arm or your forearm and the femur. And you'd say, thank you, Miss Yanez, that's really good advice. Because she would remember that. Mm-hmm.
So why is it so sensitive? Which I do notice that it's so sensitive on people.
I don't know if I have a really good answer for that. Fascia seems to be more sensitive than muscle. It has nerve endings in it too. I think this is the best answer I have, and I believe it's true, but I don't know it's true. When you work connective tissue, it is much more painful than working muscle. Think about when you guys stretch and you feel that burning sensation. That's your fascia. That's connective tissue. And all the IT band is connective tissue. And so I think it's got that hypersensitivity of connective tissue, where muscle's a little bit more forgiving, actually. And connective tissue has that burning sensation when you're pulling it apart, because it doesn't want to change. Connective tissue does change, but it changes slowly. It's avascular. It resists change. It changes slowly. Muscle changes fast and heals fast.
So what does avascular mean again?
A means without, and vascular, think of vascularity, your blood. So avascular means without blood. Now, by the way, nothing in your body is avascular. Nothing in your body is avascular. I guess your hair, but your hair is dead.
They just mean it has less?
Yes. Muscles are highly vascular, and tendons, ligaments, IT bands, fascia, aponeuroses, retinaculum, all that stuff that's all basically tendon, is very avascular. Here's why that's cool and why it is the way it is. If stuff is highly vascular like your muscles, it gets lots of blood to it. So if you tear a muscle, it heals like that. I'm not talking about a total tear, but when you tear your muscles minorly all the time, it'll heal like that. Poor Mr. Condaris, if he only has muscular damage from the fight he was in last night, he will heal like that. Couple days, bam, he'll be good as new. Hopefully, yes. But if it's muscular damage, you will. You'll be fine, sir. Because muscles have a lot of blood going to them. They're highly vascular, and blood heals things very quickly. But the problem with that is muscles are very porous. In order to get blood into them, they have to have lots of holes in them, basically. Well, things with lots of holes in them aren't as strong. So tendons and ligaments and IT bands are very strong, but one of the ways they make themselves very strong is they have no holes. They're very dense. Well, very dense makes them very hard to tear, but it also means blood can't seem to get into them. Whereas muscle, blood can get into them really easily and heal them. Connective tissue is very avascular. Blood can't get into it. It makes for very strong tissue, but it means it repairs very slowly. So you got to kind of decide, you want wimpy tissue, muscle tissue, that repairs really fast, or really strong tissue that hardly ever tears, but when it does, it takes forever to repair. That's why that is that way.
And then, so the difference between the IT band and let's just say the thoracolumbar, whatever fascia is what? And like the aponeurosis on the head, like, I mean, is it both kind of the same thing?
Yeah,
Okay.
I was about to say, I feel like I would answer your question and say nothing. There's nothing different. I think somebody might come along and argue, well, the thoracolumbar aponeurosis has muscles inserting into it from multiple directions. I'd be like, yeah, but Miss Monreal, I know, is asking about the material. And it's the same, it's the same darn stuff. Yep.
Okay.
It's the sheet-like stuff, like, if you've ever, like, made chicken and pulled that really thin layer off the top of a breast that you could look through, if you took a whole lot of those layers and put them together, you'd have the IT band or aponeuroses.
Okay.
It's that kind of saran wrap layered up so much that it's kind of white now. You can't see through it anymore. And it's that really strong stuff that if you chew, whatever, when you guys get something in your mouth that you chew and chew and chew and can't get rid of it, that's probably a tendon or a ligament, which is just more of that stuff bunched up. But anyway, it's the same darn stuff, yes.
Okay.
Thank you. Okay, we're going to go by this stuff really quickly. Okay. So, the leg on the left-hand side of your slide is more superficial. If you take all those muscles off that leg, you can see the vastus intermedius, which is on the right-hand side of the slide, right? Okay. So those are the 4 quads in this picture. They had to remove the top 3 muscles for you to see the 4th quad, which is the vastus intermedius. The vastus intermedius, just look at it as a great example. It attaches your femur to your tibia through your kneecap. And so all it can do is extend your knee. It does not go across the hip. The vastus lateralis there and vastus medialis don't. Vastus lateralis gets all the way up to the greater trochanter, but it doesn't go across the hip. Only one jumps up across the hip to the anterior inferior iliac spine. That bump below the bump that you feel on your hip. It's below and it's deeper. And that's the anterior inferior iliac spine. It's the bump in front, below the other bump, on the spine of on the ilium. Anterior inferior iliac spine. AIIS, you'll hear a lot of people call it. And because of that, because it crosses over the hip joint, when it pulls, it can cause the hip to tilt down, which is a flexion of the hip, or the leg to come up, which is a flexion of the hip, or the knee to extend. It is the only quad muscle that does 2 actions. And it causes an anterior tilt of the hip, and that's why it can affect back posture. So it is a postural muscle.
Hey, Mr. Trapscott.
Yes, sir.
I have a question real quick.
Yeah.
So, how come when people, like, they do squats or, legs or whatever, and, some people, after time, they get super defined. You can see each quad muscle really popping out, and versus other people who, they have that same strength, but the leg looks more bulky. It looks more like a cone almost. It's like you don't see that protrusion of the muscle definition. It's just like a big solid leg, Even though they can, squat 400 pounds, they just don't have that definition.
Yeah.
Like, do you know why some people's muscles get super defined and other people's don't, even if they're strong muscles?
Yeah, I do. Dermal adipose content, which means how much fat they have in their skin.
Okay.
In that area. So basically having less fat in your body, especially in your skin, makes you look more defined. And you might have that over your whole body, or some of us just, all of us in this class, there are areas of your body you don't carry a lot of fat. Even when you gain weight, you don't get a lot of fat there. You get it somewhere else. Anyway, if your legs don't carry a lot of fat, the muscle pokes through and it looks more defined. Losing weight overall will help, period, because you're reducing your fat content of your entire body, but it's really about how much fat you have in that area. And definition comes from one thing, and I mean size helps, but definition comes from one thing, it's fat content. When you see a bodybuilder go on stage, they have a fat content below 3%. I think sometimes they get down to 1%. And by the way, water content matters too. So they also do a little trick where they pull, they with their potassium balance and their sodium balance, they, don't quote me on this, but I think it's what they do is they drop their sodium and increase their potassium. And that forces water into their muscle cells and out of their skin stuff. And so they're trying to make themselves more defined that way. And they'll even take diuretics and stuff. In fact, some of the stories you've heard of bodybuilders dying on stage, which has happened, it's usually due to diuretics. They pulled out so much water out of their skin, which is their whole body, to make themselves really defined because they've already taken all the fat out. So the last thing they can do is take the water out, and it works. But the problem is your muscles need water to work, and your heart is a muscle. And so sometimes when people get that low on water, they have heart attacks. I mean, that's probably coupled with the steroid use, but it's really the diuretics that kill them at that point. So fat and water content of your skin.
Okay, thank you. That's pretty interesting.
It is interesting. Yeah. Bodybuilders will tell you most of their success on stage is diet. Okay. So let's look at each of these muscles separately just to make a couple points. Don't look at the thing on the left. Look at the thing on the right. That is the vastus lateralis. It's absolutely enormous. It kind of looks like a fish on the side of your thigh. And when you look at somebody's thigh and you see that nice sweep from the side, that nice sweep, that is, that's their vastus lateralis. And it goes all the way to the back of the leg. It's not part of the back of the leg, but it forms the entire lateral side of your leg. So if I was really nitpicky with you guys, I said, what muscle is found in the lateral compartment of the leg? You'd say vastus lateralis. Yeah? Miss Hanson, what muscle is found in the lateral compartment of the thigh?
Vastus lateralis.
That's right. And that only leaves 3 more quads that are found in the anterior part of the thigh, which is the rectus femoris, vastus medialis, vastus intermedius. But the vastus lateralis makes up the entire side of your leg. This is very important because later we're going to find out it actually kind of boxes in the hamstrings, and we'll get to that much later. But it makes up the entire side of the leg. When you slap the side of your leg, you're hitting your IT band and your vastus lateralis. And all that muscle does is reach across your knee and help to extend your knee. That's it. This picture is very important for you guys to visualize. This is the back side of somebody, the posterior side of somebody. They have removed all the hamstrings and all the adductors. Notice that the femur runs in a diagonal fashion, going outward like a V. Your body is built in these kind of triangles. We'll get to that later. But the vastus lateralis is so vast that it almost wraps around behind the leg. Yes. In fact, the vastus lateralis, part of its origin is those linea aspera lines. Remember the lateral lip of the linea aspera on the femur and the medial lip of the linea aspera on the femur? Those are the origins for the vastus lateralis and the vastus medialis. So the vastus lateralis actually has an origin on the lateral lip of the linea aspera. Lateralis, lateral lip of the linea aspera. It actually comes around and almost covers up your femur. It's so massive. Your femur is only this big around, but your thigh is at least this big around, right? So the muscle's only that, the bone's only that. So a lot of this is made up of quads and hams, all that kind of stuff. And this vastus is so massive that it grabs on almost to the backside of your leg. It grabs on to the gluteal tuberosity and to the lateral lip of the linea aspera. Your your vastus medialis is not as big, and you only see it poking out at the knee, but it grabs onto the medial lip of the linea aspera. So they almost grab onto the backs of your legs, really. They're massive. And when you're in class today waiting for lab or whatever, look at the muscular model there. Look at the leg that's up there. We have a giant leg, a full-size leg in class. Look at it this time when you go in and really kind of think about some of these muscles. It will really make you a better massage therapist.
Why do they call it a lip?
A lip? Because it really kind of is. There's this line that runs down the back of your femur like a depression, and that depression makes two little lips. Just like a depression in my mouth here makes two lips. So it's got these two lips or ridges. I mean, I don't know why they pick, lip, but anyway, lip or ridges. So you've got a lateral ridge and a medial ridge of this linea aspera, and that's the place where these muscles attach to. Cool. Sounds groovy. Cool. These are just some good pictures in your book of where stuff attaches to. Okay, one point I want to make here is, don't worry about the slide. In fact, let me stop presenting. There we go. Who can tell me where the rectus femoris inserts? Not where it starts, not up the AIIS, but where does it insert?
Are you talking about... Oh, sorry, go ahead, Jackie.
Oh, I kind of a guess, but I said the patella, the kneecap.
It's a darn good guess.
I was going to say the tibia, because I thought it went over the knee.
That is a darn good guess, too. You're both right. How can they both be right?
Please tell us.
I love you. All right. Listen up, everybody, because I will ask you this quiz question later. This is my kneecap. What's the name for my kneecap?
Patella.
Thank you. Every gallant fella has a patella. For $100, can anybody tell me what type of bone the patella is? It's a very particular type of bone.
Is it a, God dang it, socket?
A what?
Probably socket.
Oh, no.
Is
It's not a joint. What kind of bone is it?
it cartilaginous, something like that?
I love these answers. That's actually pretty good. It's called a sesamoid bone.
Oh, okay.
Anybody know what a sesamoid bone is?
It sounds like sesame seeds.
Yeah.
That's what I was going to say.
It's a bone completely wrapped in cartilage. So it is a kind of a free-floating bone here. It really is a cap, and it really is a bone. And its job here is to keep my thigh in. I'll explain that in just a second. But it's a bone here. The reason that Mr. Quadriceps and Miss Petrie were right is that all of your quads, I'm not going to take them off completely, but all of your quads attach into this bone. All of them. And then this bone is attached into your tibia. So don't get me wrong, Miss Petrie is right. They all go into your tibia via this bone. So your book says they insert into the tibia, into the tibial tuberosity, which, by the way, you could all feel this on your tibia. It's a bump right here. You should feel a bump below your kneecap. Everybody should be able to feel it. You should be rubbing it right now. This is your tibial tuberosity. All your quads insert into your tibial tuberosity via the patella and the patellar tendon. So all of these feed down into the patella and into the tibia. It's all really one piece of fascia. So,
Okay, but you know Martha has to understand things.
good, because I'm about to ask Martha stuff. Go ahead.
Okay, so, but specifically, does the rectus femoris attach a little bit further than the other ones, or they all attach at the same place?
No, they all go to the same party. They all go to the party at the patella house, and that party has a connection to the tibia. They all share a tendon. They all share a tendon down here.
And then what kind of socket is that again?
What kind of what?
Or what kind of
Bone?
what did you call that? A joint bone?
It's a bone called the sesamoid bone. It's a type of bone. Yep, you've actually got it some other places in your body that we'll talk about later, but the biggest ones in your body are your kneecaps. And they're bones that are really just kind of wrapped in fascia. All this fascia comes down here and hooks into it, and then they tie it with more fascia to your leg. It's called a sesamoid bone. It's literally wrapped in fascia.
Okay.
Yeah. So, let me ask you a question. What do we call the stuff that attaches the 4 quads to my patella? What's this fascia up here called that attaches my 4 quads to my patella? What do we call this fascia?
A tendon?
Tendon, because it attaches muscle to bone, right? So these are the quadriceps tendons because they insert into the patella, which is a bone. Quadriceps tendons. What's this piece of fascia that hooks the patella?
Is that what they're actually called? Is quadriceps tendon?
Yeah, sure.
They don't have like another kind of like special tendon name?
I think that's pretty special.
No, I'm just I'm just saying that some tendons have like an actual, I don't know, name that goes to them.
You're right, actually. These kinds are called...
It's just called the quadriceps tendon?
No, these are called cool in the gang tendon. And...
Cool in the game.
Yeah, yeah. And this is the patella pops. And anyway, no, it's the quadriceps tendon. It's the quadriceps common tendon. It's the, I'll give you another name. Sorry.
No, I'm just
No, wait.
making
There is
sure.
another name though. There is
Understanding.
another name. This is the patellar tendon.
Oh, see?
Yeah,
Look
you're
at
right.
that.
You're right. You're right. I forgot.
Yeah.
It's the patellar
Yeah.
tendon. So all 4 quads insert into the patella via the patellar tendon, if you want to get really precise. So, what's this called down here? If this is the patella tendon, what's this called down here, Miss Petrie, that attaches my patella to my tibia?
It attaches the patella to the tibia?
Yep, attaches this bone to this bone. If this is the patellar tendon that attaches muscle to bone, what's this called down here?
The tibial tendon?
So,
The
this,
ligament?
yes, so it's called the patellar ligament.
There we go.
Patellar tendon, patellar ligament. By the way, everybody, it's the same fascia. It's just kind of running over this sesamoid bone and right into the leg. But
So
just
they
like
just name it differently to set it to where you know.
Just like if you ever been driving on a road and all of a sudden the road's called a street or an avenue, but it's really the same road you're on. But back there it was called, you know, Greenway Road, then all of a sudden turned into Greenway Avenue. It's the same darn asphalt, but we call it different stuff because of where it is. When this fascia forms here and attaches the muscle to the patella, we call it patellar tendon. When it attaches the patella to the tibia, we call it patella ligament because ligaments attach bone to bone, but it's all the same stuff. And it all is going to pull together, right? And cause me to kick out my knee. Yeah?
Yeah.
Now, by the way, I'm sorry, well, let me show you one other thing. By the way, I did shortchange you guys a little bit. Because I said, I kept trying to make such a big deal out of this rectus femoris that I made it sound like these other muscles don't matter at all. They all reach here and grab here. So it is true that, by the way, if my vastus lateralis or vastus medialis are tight and the other one's loose, it could affect my knee alignment. And that, which Ms. Monreal was kind of hinting at earlier, that could affect my knees a lot. So these muscles are important to knee stability and knee alignment. They just don't affect my postural stuff upstairs. Although if my knee's messed up, that will affect postural stuff up there. But even though they all go to the same place, if this one pulls more to one side than the other one, that can affect my knee alignment, and that's a problem too. But vastus lateralis, vastus medialis, and intermedius affect knee alignment. Only rectus femoris can affect anterior tilt of my pelvis, can create anterior tilt of my pelvis. I hope we can visualize all that. Yeah? Okay.
Until I take the test, I can.
Yeah, that's kind of the way it works, huh?
Right.
So questions so far? No?
Yes, I have one.
Please.